start? Yeah, fantastic, good. So I would like to do some explanation before doing the mobilization, because that explanation will help you to see what I'm aiming to. Yeah. So we'll do it with clothes right now, just to make it practically. Although in practice you will be having your client undressed, and you will put the towels, yes, etc., etc. But for now, just to learn it, let's avoid it, okay? So we can see a bit more, but later on we will practice really fully with undressing and the towels. Okay. Right. The first place I would like to do the mobilization is the neck. Okay. So, what do you think would be an effect of moving the neck? Let's say, let's do it, and you tell me what do you think the effect of, say, something like that?
Stretching it.
You're stretching the muscle. So which muscle you're stretching?
Sternum.
Alex yesterday, what she asked, yeah? So which muscle would you stretch?
Sternocleidomastoid.
Not much.
Scalenes.
Trapezius.
Not much. Levator scapular and trapezius. Come closer. Come closer. So trapezius will attach from here and goes all the way down. So let's have a look at it again. Yeah, from here to here, and even stretching that. Do you see what comes out? That's a fiber of the trapezius muscle, the front of the trapezius. By the way, which muscle is that? Sternocleidomastoid. If you want to see it well, lift your head for a minute, a little bit. Do you see that?
Yeah.
Yeah? Thank you. So it starts where from?
Clavicle.
From the medial clavicle and the sternum. Sternocleidomastoid. Mastoid is the process here behind the ear. Yeah, this is the mastoid process of the temporal bone. No, I forgot which bone is it.
The masseter?
Okay, so, right, so the first thing, we're stretching, right? The second thing, we're also moving the joint in the spine, and we're stretching the joint a little bit, yeah? So imagine all these small joints in the spine, you're now moving them, yeah? Okay, now I'll show you another mobilization that's called traction. What I'm doing actually, I'm moving the head upward. So again, a lot of muscle stretching, isn't it? Good. Now, imagine that
how hard are you pulling?
I will talk about it in a second. Now, I still want to talk about the effect of it. Now, another effect is about clients that are very tense. And I'm not sure if you felt it, but some clients are so tense that whatever the massage you give, they wouldn't release it. They're just there, stiff like a rod of metal, and doesn't move. So you can do massage until the cows come back home, but nothing's going to happen. You start moving it, and what you find out that they resist you. They resist you because suddenly you take control over the body, and they're much into stress and control, not good for them. So this is another way with mobilization to help them to first recognize the problem, to say, you feel stiff, well, you can't move because you're not letting go. If I massage the arm, for example, and I feel that it's very stiff, if I start moving it, she has to let go. It's an awareness, it's a sensory awareness to her brain to say, what's going on? And I have sometimes clients, it's so funny that I do that, they don't let go, they're holding it, hold your hand in, and then I kind of do that. And they keep, and they don't recognize that until they find something is funny going on. And this is where massage is not only treatment, but it's really educating their body to their situation. In a way, you show them the mirror of their situation right now, and it works wonderfully for those who really have difficulty in letting go. Yeah. So same in the neck, you know. Okay. Now, so these are two effects of the stretching. Of mobilization. You stretch the muscles, you move the joints, and also you give some sensory input back to the client about how much they can let go. And it's kind of hard for some clients to let go. And they will find that you're fighting them, but this is the client exactly that this kind of treatment would work really well for them. If you do massage for 2 hours, nothing works. You need to start, with jostling, remember that kind of technique?
Mm-hmm.
Yeah? Can you stiffen your body for me? You would feel that they don't let go. And you need to, in a way, exhaust them until they understand what letting go is. So the same here with the shoulder, start moving it, and then if they're holding it, then letting them to hold it, and then show them. They have to. It's hard for them to acknowledge it. You have to show them something as vivid as, look what happened, and talk about it in a massage. Don't think about relaxation. You're not going to relax them. Really think about educating. And there is a talk that you can do here for about a few minutes. And this is the best time to do that because you hit it when it's hot. When they recognize how much they stress and tense and why your treatment would help them, you need to do it now.
So when would you do it? Because I had someone who came in and she was so incredibly tense, I just couldn't get her to relax.
Yep.
So would you, and she was face down to
Yep.
begin with, and would you do a whole effleurage and then some mobilization?
Sometimes, it depends on the assessment really. If I see that right away it's not going to go anywhere, I wouldn't do even effleurage. I would start with it.
Yeah.
And I might move that client almost 3/4 of the treatment. Yeah? So I would start, say, effleurage here. I would see that it doesn't work. And it's kind of subjective assessment. Then I would say, okay, change of plan. And I would say, I feel that it's a bit tense. Can I start doing mobilization? And really, when I do mobilization, I talk to the nervous system. Most of all. What do I mean talking to the nervous system? If I do that, I try to tackle and say, okay, where is it not going and why? And then do it. And actually ask her nervous system, the client nervous system, to relax. This is really the most important thing. You are not going to have a lot of clients with severe arthritis that you need to do joint mobilization. Most of our clients are tense. And tense because they are stressed. So I think most of what we can help them in joint mobilization is not what you see in a lot of other courses. They teach you mobilize your joint. Hey, come on, she can do it all the way. She doesn't need it. Yeah? The joint is fine. It's just that the stress can cause tension. Remember the sympathetic nervous system? And tension then build up a pattern of contraction and not moving, to the extent sometimes that people have very limited vocabulary of movement. They do it very strong and they use a lot of force to do something, and you need to teach them how to do it gently. How to actually do it so gently that you can do it and they just relax and observing it.
Do their sensory nerves kind of get used to their joint or their muscle being that tense, and so they think their sensory nerves in that area think that that's normal? So that they've learned to not relax because that's...
So let's see where the problem, okay? Is the problem really in the sensory nerve, in the brain, or in the motor nerve? If people like that are tense, where the problem is?
The motor nerve.
Okay? So the motor nerve, you're saying, Alex, that it's in the motor nerve because in the motor nerve send signals to the muscles. Yeah?
Too much.
Okay? But who's the boss of the motor nerve? The brain. And that's what I'm saying. You talk to the brain. You talk to the nervous system. Actually, you talk to the brain. You talk to the brain, really. So if the brain would be relaxed and learn how to relax, and you create this pattern of relaxation, motor nerve would right away get. And that's a mistake I think that a lot of therapists doing, and a lot of even research in massage, that they put an emphasis on the motor nerve. Yes, relax the muscle by working on that. I think it's a lot more in the brain. A lot more in the brain. You need to teach them what is going on, yeah? And you can do it quite complex even. You know, you can do certain joint mobilization that you see how much relaxation she has to do now. Yeah? You would find that people would have it, and I'm just tackling the nervous system to say, okay, well, it's a complex movement. Can you still relax? Yeah? Okay.
And
It's
you
not
can
easy.
do massage techniques whilst doing that.
Exactly. And that's where complexity comes in massage. It seems easy, but it's not easy. Complexity comes with taking two simple massage technique and blend them together. So I'm actually not doing mobilization just, but I'm actually always like saying to the muscle, relax, relax, you know, keep it relaxed. Yeah.
Do you find when you're doing mobilisation you talk a lot more to the client because they might not know what you're
Yeah.
doing?
Yeah. At the time, no, because I want them to not know.
Okay.
Because I want them not to know, because I want them to be able to relax as much as possible without knowing what I'm doing. And what happens usually is the client brain start to guess and try to help me to do. So I'm breaking the pattern. If I do a pattern of movement this way, usually you start feeling, hey, I'm not doing it, they're doing it. So I will change, and then I'll do it a little bit here. And then this is where talking to the brain is to say, it's almost like I'm saying to the brain, you can't catch me, you have to relax. Because they always try to help you, to be in assisting to you, but you say, no, let go, yeah, let go. No, you don't know what I'm going to do, let go, because you need to learn how to let go and not to do it again. Because what happened in stress is that we used to so much to the pattern that it becomes repetitive strain problem. So in a way you want to teach them a different pattern, a different being, by just relaxing and observing things rather than doing. So really in the sensory interneuron brain and motor nerve, the problem is really in the brain. So we need to tackle the brain, okay? One last thing that I want to do before I'll let you try out a little bit is really the art of moving their body parts in relaxation. Okay, so I'll show you a few ways you can move the neck, okay? One way is that, yeah. Do you see what happened to the sternocleidomastoid? Do you see how contracting it is? Why is it contracting? And now I'll do it in a different way. Okay. Do you see that it's not contracting? Yeah. And I'll do it again now in here. Yeah. Why is it contracting now?
Holding your head up, flexing your head.
It's not so much the flexing, but I do something else. I lift the head. Here, I'm rolling it heavy, and actually what I'm doing is putting a bit of weight down on the forehead, putting pressure a little bit on the head down, and then rolling it. I'm rolling it, I don't lift it. Here, can the camera maybe go down? Yeah? Can you see that I'm lifting the head? Yeah? And why the client actually start contracting the muscles on the neck when I'm lifting the head?
Because they're trying to hold it there, I guess? Or?
Why are they trying to hold it?
I guess they don't know if you're going to let go and with trust.
Exactly, there is a trust problem. The trust is very important. If you want them to relax, they need to trust you. They need to trust that you are holding it in a good way. So I'll let you try it. And I want you to really negotiate and see with the client, where do they feel trusted? Okay, I want you to find that. Okay, so try that, and then we'll come back to do more.